Hello, today is the day 232 of 365 days project and I am here to continue about the colorectal cancer. Let's see what are the other risks, which may vary on the different factors. First factor is age. Nearly now 9 out of 10 people diagnosed with colorectal cancer who are aged above 50. Personal history of the colorectal polyps or colorectal cancer. This is especially true if the polyps are larger than any of them. Personal history of inflammation, bowel disease. Inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease, causes long-term inflammation of the colon. Family history of the colorectal cancer, adenomatous polyps. While most colorectal cancers occur in people without a family history of colorectal cancer, about 1 in 5 patients have other family members affected with this disease. Having family members who had an adenomatous polyp is also linked to the risk. Inherited syndromes. About 5 to 10% of the people who develop colorectal cancer have inherited gene defects, which are mutations. The most common of which are familial adenomatous polyps and hereditary non-polypous colorectal cancer. People with these genetic syndrome may develop a colon cancer early in the life and are at risk for other type of cancer. Other rare inherited conditions that increase risk include Turcotte syndrome, Petews-Jeghers syndrome, mutate-associated polyps, type 2 diabetes, physical inactivity, obesity, smoking, and excessive alcohol consumption or some other factors which may lead to increase the risk of colorectal cancer. Let's see the symptoms. Often there are no obvious signs of colorectal cancer, but some symptoms include or change in the bowel habits or frequency, bloody bowel movements or rectal bleeding, generally abdominal discomfort, unexplained weight loss, chronic fatigue, bloating, unexplained anemia. Let's see about the diagnosis.